vaccinated so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated. Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
Yeah, that's me, yeah.
我们能够做到.
Podemos hacerlo por todos nosotros.
Hindi man అందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
Hello and welcome everyone to the Friday Update with Mendocino County Public Health. My name is Cameron Brown, and we're very happy to have Dr. Andy Coren, the Mendocino County Health Officer, with us today. And we'll get the latest COVID-19 updates for the county from him. And after his presentation, we'll take some questions from local news media outlets. And we'll also be checking the live streams on Facebook and YouTube for any public comments. So let's jump right in. I'll hand things over to Dr. Coren. Thank you.
Thank you. So we are seeing a rise in COVID cases again throughout Mendocino, and now the state is also showing a similar rise. Our average daily case rate has increased to 22 cases per 100,000 per day, which is over a 50% increase in the last 2 weeks. The state is also showing a significant increase involving 20 counties. Next slide. This slide shows our case rate compared to surrounding counties on the left. And you can see that Mendocino is the line in purple, Lake County is in red, Rancho is in green, and the California line is the blue line. Sonoma is the brown line below that. We have a lower rate than the general Rancho or Northern California counties, but clearly higher than Sonoma County, which is in the Bay Area region, and California as a whole. Next slide, please. We've been doing well on testing, and our test positivity is a little bit more reliable now. The test positivity has increased 43% in the last month to 6.3. This is a very important sign of community transmission, and so the community transmission is our main identifiable source. Testing is now more accessible, and the turnaround time in the state for the PCR tests is less than 2 days in 95% of cases. So I want to encourage more people to get tested. We have 184 people in isolation, 65 in quarantine. I'm sorry to report that there are 2 more residents who've passed away, bringing our total to 90 deaths in Mendocino County. Most recent cases involved a 74-year-old vaccinated woman with many comorbidities and a 56-year-old unvaccinated woman. Hospitalizations are slightly lower than 2 weeks ago from the point of view of COVID hospitalizations. As of November 4th, we had 9 patients in our hospitals, including 1 from out of county. And additionally, there are 2 Mendocino County residents who are being hospitalized out of county because they require a higher level of care than we have. Our intensive care unit availability today is 6%. Our hospitals are very busy, but less now are due to the COVID patients. Monoclonal antibody treatments, which decrease emergency room visits and admissions, are not being well utilized since people are coming in too late for care. Monoclonal antibodies are safe and effective, but there is a limited window to administer them. An example is an elderly woman who was sick for over 10 days when she went to the emergency room with a persistent cough. Unfortunately, she had come too late, and she had to be hospitalized for 2 weeks. This medicine is an infusion, or in some cases given as an injection under the skin, but it has to be given within 10 days and preferably within 7 days of the onset of symptoms. So if you do have symptoms, especially if you have some risk factors such as age, obesity, heart or lung disease, go early to the emergency room in Ukiah, in Fort Bragg, where the monoclonals are given by infusion. And for those in the Covelo Round Valley area, monoclonal antibodies are also available at the Round Valley Indian Health Center, and now Long Valley Health Center has given their first dose. Can you hold on this slide for a moment? Soon there will also be versions available by prescription from Merck and from Pfizer. Vaccinations, the big news is Pfizer vaccines for the 5 to 11-year-olds have been given emergency use authorization by the Food and Drug Administration. These will be available starting next week in our county vaccination sites at FQHCs, rural and hospital clinics, and the Department of Public Health is sponsoring school-located clinics in Ukiah to get as many children vaccinated as soon as possible for a safe and healthy holiday season. So many people don't understand why we should be vaccinating in this group when it appears that so few are infected and the illness in this group is usually less severe. And this slide explains an awful lot of why it is. The burden here in the United States shows an estimate of, from serum samples, 38% of 5 to 11-year-olds have been infected. And this is similar to adults. And this slide goes over other burdens. 1.9 million cases have been documented. 8,300 have been in the hospital. 2,316 have had the multi-system inflammatory syndrome for children, and 94 deaths have occurred here in the United States. But the burden also goes beyond that. And I'd like to have the next slide, please. In this slide, we can see that in the year from October 2020 to October 2021, the number of COVID cases ranked as the 9th leading cause of death in children 5 to 11 years old. Also, there are post-COVID symptoms, which include problems with fatigue, headache, insomnia, concentration, muscle and joint pains. And in the UK, 7 to 8% of children who suffer from COVID have wound up with long COVID, which is increasing in the younger ages. And the next slide, please. We mustn't forget also the indirect impacts of the pandemic: mental and emotional health problems, loss of caregivers. It's note that over 148,000 children in the United States have lost a parent due to COVID in the last year. There's loss of educational opportunities and many others that are listed here. As well, transmission from children is similar to adults. The next slide, please, shows other preventable illnesses that have resulted in hospitalizations that we routinely use vaccinations for. So this first slide shows hospitalizations per year, and these were prior to vaccinations being started. Hepatitis A, less than 1%, and we give vaccinations for children for that. Chickenpox, 4 to 31 cases that were hospitalized per year. Influenza, 30 to 80, and COVID is 25. So it certainly is in that range that we want to protect people. And the next slide shows mortality among these vaccine preventable diseases. Can we go to the next slide, please? Oh, I think we went one past. No, okay, these are the deaths, okay? So again, looking at the numbers, hepatitis A, meningococcal or meningitis, 8 deaths in the age group 11 to 18 years in the time period from 2000 to 2004. Varicella, which is another word for chickenpox, in 5 to 9 years, 16 deaths. Rubella, or German measles, from 1966 to 1968, 17 deaths. Rotavirus is primarily a viral illness of the very young, and there were 20 deaths recorded, whereas in the last 1 year, COVID has taken 66 children in the United States. So clearly there are reasons to give COVID vaccinations to these children, just as there are reasons to give vaccinations for the other vaccine preventable diseases. In the next slide, we want to look at some of the safety issues. And the FDA has looked at this with extensive research, and they have found that there are no significant or very, very few significant adverse effects. For the most serious ones, anaphylaxis, myocarditis, Bell's palsy, appendicitis, there were none of these in the group that was studied. And there are some other defined adverse events that also showed no increase in those people who received the COVID vaccine. So, and then finally, if we go to the next slide, we talked about efficacy. Oh, here's another slide about the safety conclusions. The side effect profile in this study did not suggest any safety concerns for the BNT162b2 is the technical name for Pfizer. So no safety concerns for children in the 5 to 12-year age group. We are going to continue to follow this using the Vaccine Adverse Event Reporting System, VAERS, and also VSafe, which is really a downloadable program that goes into the federal database and is looked very closely at. The next slide should be efficacy, and you can see the blue line are those people who were given the Pfizer low dose for appropriate for this group, and then the stepwise brown line shows the people who had occurrence of COVID who had only been given placebo. So significant improvement in protection. So also to answer any other questions the parents may have, we will be having a town hall on November 15th at 6:30 p.m. for parents working in Mendocino, and we will be working with Mendocino Office of Education, Mike McGuire's office, and California Department of Public Health to answer questions, and we will have some local physicians as well. As we predicted 2 weeks ago, third shots and boosters for Moderna and Johnson & Johnson were given emergency use authorization by the CDC and CDPH and have been available in our county through our public health clinics FQHCs, rural clinics, and pharmacies. With the rise in cases and the influenza season upon us, I recommend that eligible seniors and immunocompromised people and those with higher risk due to occupational exposure or social disparities get these vaccines as soon as possible. This always raises a question when we bring up boosters, the question of efficacy, and research recently published in California from October shows case rates among those vaccinated, these are case rates, are 1/7 of those who are unvaccinated. Hospitalizations are 1/10 of those who are unvaccinated, and mortality is 1/15 of those who are unvaccinated. So these vaccines are still very effective. Now let's get into the numbers. As of November 2nd, in Mendocino County, we have distributed 116,637 doses. And on this slide, it shows that 72.4% of eligible Mendocino residents are fully vaccinated. And on the next slide, it shows that 8,243 people have had booster shots or third doses. No, please go to the next slide, in this county. And this shows it by age group and race and ethnicity. And I'm just going to go over in general our vaccinations. From an equity perspective, we continue to exceed the state of California among the lowest resource communities, quartile 1, and in the Hispanic population, where 60.2% of our Hispanic residents are fully vaccinated, compared to 68.6% of the non-Hispanic white population. And that disparity continues to shrink as more of our Hispanic residents are getting the vaccines. Native American community still has only 50.4 fully vaccinated, but that number is increasing as the trust in the vaccine is increasing. Our youngest age groups, 12 to 49 years old, are less vaccinated than in California, but they are the most affected. And the 50 and older are vaccinated at a higher rate than in California, but unfortunately, they are also the ones who suffer the most hospitalizations and death. The other thing I just want to remind us all about is that vaccines for COVID may be given with this year's influenza vaccines and any other childhood vaccines that may need catching up. Turning now to schools, we have still had no outbreaks in schools. There was an outbreak among Willett's high school football team traced back to a postseason party. Thankfully, this was kept out of the school, as so many other outside contacts have been through the past year. Classes did not need to be interrupted. Outbreaks have been resolving. There was an outbreak at a skilled nursing facility in one of our hospitals, and both are winding down. They were both brought in by new admissions found to be positive on early testing. The Round Valley outbreak continues, but with very few cases being reported, and on many days per week, there are no new cases reported. As far as new orders, I've just released several new or updated orders. The updated schools order will decrease the testing burden for school-based modified quarantine for staff and students. Also, new county recommendations for youth sports and after-school activities were released. We also updated orders for isolation and quarantine, which outlines the shortened quarantine that is possible if people are tested on or after day 5. They can return to their usual activities after day 7, but they should be continuing to be cautious and watching their own symptoms, and if they're around vulnerable people, wear a mask. In summary, we do seem to be entering a winter wave and possibly a surge. We cannot predict whether this will be as terrible as last winter or last summer surges. We do have more people vaccinated, and there may be some measure of natural immunity recovering from an infection. But there is colder weather and holidays causing more indoor gatherings, parties, and celebrations. And there's still a possibility of a new variant emerging from those infected that may resist current immunity. And with the influenza season coming, we could see another very bad twindemic season. So please, let's make every effort to minimize transmission by getting vaccinated if you're still unvaccinated. Vaccines are the most reliable way to gain immunity. Get your third dose if you're immune compromised, or a booster if it's been 2 months since your Johnson & Johnson vaccine, or 6 months since your last Pfizer or Moderna series. And plan on vaccinating your 5 to 11-year-old children. Let's get all the young ones vaccinated. Even the 12 to 15-year-olds can do better with vaccinations. They do have a lower risk of severe illness, but some will suffer very severe disease or long COVID or even death. And they do transmit the virus, especially to vulnerable relatives, and they can harbor a mutating virus that could turn into the next severe variant. So let's vaccinate these children. These vaccines are safe and effective, and they're free, and they will let us return more toward a normal life so we can enjoy the holidays and we can enjoy each other. In the meantime, whether vaccinated or not, if you have symptoms, stay home, get tested, follow isolation and quarantine instructions, which are new, allowing shorter quarantines, and speak with the contact investigators that would call you if you get tested and are positive. Wear masks indoors in public places and outdoors in crowds. If you go out to eat, keep your mask on except when you're actually eating or drinking. For safer eating out, start looking for the green signs that show which restaurants or bars in Mendocino have staff vaccinated or tested and are only allowing vaccinated patrons to enter. And look for the yellow signs that says the staff are vaccinated or tested. If you can't be outside, remember to increase your ventilation inside. Keep your distance from non-household members and remember hand hygiene. Keep parties small, preferably limited to household and family. And remember, outdoors is safer than inside. And finally, use hand sanitizers often. Stay safe and stay well during this season. And that'll be the end of this presentation. If there are any other questions, please let me know.
Thank you, Dr. Coren. So we'll move into the question and answer segment now. And we do have 4 members of the local news media with us. So in the interest of time, we'll go through some rounds and have 1 question per outlet. If you do want to ask a follow-up question to clarify, please try to keep it just to 1 follow-up for clarification, just so we can make sure we hit everybody. And we'll also incorporate 1 question from the public in these rounds too. So hopefully we can get to everybody's. Let's begin with Judy with Mendo Fever.
Hi, thank you for the opportunity to do this. There's been a pattern in Mendocino County Public Health press release regarding COVID-19 fatality information. Public Health discloses that there are complicating comorbidities when a descendant is fully vaccinated, but you do not disclose the details when they are not vaccinated. Why is this? Why not address the influence of comorbidities in both vaccinated and unvaccinated?
Well, I think the question has been, if people are vaccinated, why are they getting very sick and hospitalized? So I've tried to include that as part of the report because the mortality of the vaccinated people is extremely small unless they have had significant comorbidities.
Okay, so, but if a person is not vaccinated, could it be an underlying illness that caused the death as well?
You know, if we determine that really COVID was not involved, it's not a COVID death. So if the COVID is the primary reason why they pass away, then that's the reason that we're putting forward. It is certainly possible that people who are unvaccinated have comorbidities, and many of them do, and the COVID, of course, complicates all of that.
Sure. Okay, thank you.
Okay.
All right, thank you, Mendo Fever. Let's move on to Susan with Independent Coast Observer.
Thank you. I'm just wondering about compliance with this red, yellow, and green idea. I know that was supposed to take effect November 1, and I wondered, are you seeing compliance with that? And if you're not, what's the penalty for someone who's not displaying a placard outside of a business saying whether it's red, yellow, or green?
So Susan, I have actually been working from dark to dark. I haven't been out there to see it, but I'm waiting for reports, and I've heard some and gotten some in the mail. It's kind of interesting. There was a lot of pushback about having the signs at all initially, and in the last week, I've gotten a couple of emails saying, "Make it all mandatory. We don't want to have to make these decisions." So no, I don't know. The penalty is it's an order. And so a person who does not comply with the order of posting would be subject to potential fine or even imprisonment. But by and large, understand that this is an honor system. We want the restaurants who are going the extra mile for the safety of their staff and their patrons to be able to say something about that and attract new people to their restaurants and bars. This is not being done to divide or to penalize anyone. We hope everybody will get on board with protecting their patrons and their staff. And that's the reason for it.
Thank you. Is the enforcement agency involved with this code enforcement?
Yes, they might be involved if we needed to go that far. At this point, when we're seeing that people are not complying with orders, most of the time when we have a report, it's a phone call, education, and a reminder, and that's pretty nearly all that's been necessary.
Thank you.
And thank you, Independent Coast Observer. Let's move on to Dave with Mendocino Voice.
Do we have an exact count of the number of businesses that are complying with the program?
No, I do not, Dave.
Okay, that's it for me. Thank you.
Thank you, Mendocino Voice. And then finally, we have Mendocino Action News. Danila.
Hello. Thank you again for having this meeting. Dr. Coren, you mentioned that there was going to be a town hall meeting at 6:30 p.m. Can you repeat the date, time, and how that meeting is going to be held?
It'll be a Zoom meeting, and it'll be for parents. It's going to be advertised through the Mendocino County Office of Education.
So for those that are homeschooling and not enrolled in Ukiah Unified, how will they get notice?
Oh no, it will be Mendocino Office of Education, so they will get they will be notified, and they will be welcome to come.
Okay, I think I was trying to say, for those that are homeschooled not through the Mendocino County system, will they find out how to attend that Zoom meeting? Will it be posted on their Facebook page or a flyer?
I'm sure it will be.
Okay, thank you.
All right, thank you, Mendocino Action News. So I haven't seen any Facebook reports yet, but we'll keep looking. And we'll start back with it was Judy with Mendo Fever. If you have any more questions.
Yes, thank you. We get quite a few comments on our Facebook page and questions. And yesterday, Trinity County announced they were rescinding their masking mandate in public settings. Humboldt County's public information officer described the metrics the Humboldt County must meet. Now that we see other counties considering an exit strategy, I'm hoping you can describe the metrics Mendocino County will use to determine when the indoor masking mandates will be rescinded.
That's a very good question, Judy. I've participated in the conversations with the health officers, of course, of Northern California region, which we are a member county of, and also of Abajo that sort of led the way in this charting out the exit strategy. And I have not developed an exit strategy for us at this point because I'm not so sure that we're ready to exit using masks. So I know that there's an awful lot of public pressure. We don't want to wear masks, but if we're heading into another surge and we don't have much room in our hospitals as it is, not counting COVID, and we could threaten our healthcare system considerably, I don't want to put hopes up that, oh, we're getting ready to take off the masks and then be pushed to taking off or releasing people from the order of wearing masks indoors and then have to put them back on. Masks continue to be the least expensive, most accessible, and the least problematic and most helpful way to avoid these respiratory viral diseases. And so when we really do see some real progress, then I'll be more willing to make some predictions and set out some parameters. But at this point, I in Mendocino County has not joined that group. In the Rancho Health Officer Group, which is about 10 counties, only 3 of them actually did produce their projections. And many of them were in better shape a few weeks ago when they wrote it. I know Abajo was, and now they're all rethinking that. Still, they build in the possibility of not taking away the masks or reducing the mask mandate. But I have not felt the need to publish that at this point.
Okay, and thank you.
Thank you, Mendo Fever. We do have one question from Facebook, and they're wondering how many people who are fully vaccinated have died from COVID-19 in Mendocino County.
Oh, I don't have that answer right off the top of my head. That's a good question. Kirk, do you happen to have that information? I don't think we've tallied it up recently.
No, I don't have it off the top of my head, but we could definitely look at that as a public records request. I know we've produced the data before, so if they want to send an email to DOC call center at mendocinocounty.org, we can send them the data.
Great.
Okay, sounds like a plan. So let's go back into some questions from reporters. Susan with Independent Coast Observer, do you have any more questions?
Yes, I'm just wondering, the RCMS clinic down here in Molalla is going to begin giving the shots for 5 to 11-year-olds. And that is on schedule, I believe, for starting next week. And I just wondered how quickly the schools, clinics, and the rest of the effort will be mobilizing.
Most of the vaccines are going to go through the clinics during clinic appointments, and RCMS is doing the same. They're also, I believe, planning some Saturday children's vaccine clinics. And the others are also following suit. Over the next week, they'll be offering it in their clinics for clinic appointments. And then there are some special vaccine clinics that I believe start this coming week and are more firm next week. The county clinics will begin on the 15th, or wait, let me just take a look at that. I believe it's on the 12th that we have our first county clinics offering childhood vaccines. And then we'll have them at our regular public health outlets and also, as I said, in Ukiah, our clinics will be having patients come through the clinics, but we're also having some school located events in Ukiah. I don't have the schedule right here in front of me.
Okay, thank you.
Okay.
Thank you, Independent Coast Observer. And let's move on to Dave with Mendocino Voice.
So you mentioned that there haven't been any outbreaks in schools, but also that there has been an outbreak with a school football team. That seems counterintuitive to me, and I was wondering if you could explain exactly what you mean and what terms you're using and how there.
Okay. So we describe an outbreak as 3 people who are linked to the school that have caught it in the school, and they have not caught it outside the school through family or through parties or that sort of thing. So an outbreak is different than people who are school-age children who have it, or even a case that was discovered in school, but that was with their testing on entry or with they have symptoms and they're sent home and there are no further there's no further transmission within the school. So when I say there have been no outbreaks, there's not been transmission within a school that involved 3 people that were linked epidemiologically. In other words, they crossed paths for 15 minutes within 6 feet for at least 15 minutes in a 24-hour period, and they likely have passed it that way, and that they wouldn't have gotten it another way. Does that make it a little bit more clear to you? So the big outbreak on the school football team, where those children did not come back into school and they didn't get it through school, that's not considered a school outbreak.
All right, thank you, Dr. Coren, Mendocino Voice. And let's see, finally we have Danila with Mendocino Action News.
Dr. Coren, earlier on you said some data, and I want to make sure I got that clear. You said 66 children total have died from COVID-19 in the US. Did I get that right?
In 1 year.
In 1 year.
Yeah, there's been a bit more than that since the start of the pandemic.
October of last year to this October?
Yeah, I believe that's when it was. Let's just take a look. So within the United States, there have been 94 deaths since the pandemic began. 94 deaths of children. Children 5 to 11 years of age. That was one of the slides that I put up.
So the 66 is 5 to 11?
No.
No. In the 5 to 11 year group in the United States, since the beginning of the pandemic, 94 people have died. 94 children have died. Okay. Oh, we got 66. Let me try and find that. I'm sorry, I'm not seeing where I might have said 60 something. So I don't have that information.
I can try and do a review of the slides, find that if necessary. We do have one question from the public. And
I believe it's slide 3.
Perfect.
It's slide 3, but that points to 94 deaths of children.
Maybe I heard something
Oh,
incorrect.
no, I see what you're saying. Okay. Children 5 to 11 years old from October 3rd, 2020 to October 3rd, 2021, 66 children were died, and that is nationwide, but that put it as the 9th leading cause of death in that age group.
All right, well, looks like we found our answer.
Yep, thank you.
Perfect. So from Facebook, we have a few different questions asking about natural immunity and why is this not being part of the conversation more with vaccines?
Well, that's a great question. And there has been a lot of very good research that they're working on, and they've published it recently. There was a publication of hospitalized patients and other national data that has been published. And there is good immunity, but it's variable. So some people who have had an infection will be very well protected. It usually depends on the severity of their infection. They may be more protected, but if they are immune compromised, it may be less. And as time goes on, it wanes, and it wanes more than the vaccine immunity. So when we look at, there was recently published in the CDC weekly morbidity and mortality journal, an article where they looked at the numbers of people who were in the hospital and the percentage of them that had an infection and then wound up with a hospitalized case of COVID versus those who had been vaccinated and wound up in the hospital with COVID. And the numbers actually continue, whichever way we look at it, to show that the immunity that comes from a vaccination is the most reliable and the best immunity, in the sense that it's more consistent and it lasts longer. Now, for people who have had an infection, we're not recommending that they have to get a vaccination within the next 3 months, because unless they have some other illnesses, their protection is pretty good for 3 months. Again, the more vulnerable people, not so reliable. But for those people who have an infection and then get a vaccination after it, that's probably one of the best ways of becoming immune. So we're now being able to look at what they call natural immunity. The problem is actually figuring out research that can give us those answers. And so it's a research design question. And all the research that's been done so far really does show that the immunity that comes from vaccination is more robust. It's more clearly active, and it lasts longer than the immunity that comes from an infection. And they're looking much more at that at this point. But I think that the conclusions will still be that vaccinations are very well worthwhile and very protective.
Thank you, Dr. Coren. So it looks like we're back to the start of our round again. Mendo Fever, do you have any more questions?
Yeah, I have one more. Many Mendocino County residents are concerned about the mandated vaccines for school children. Some are predicting, despite legislation that limited vaccine exemptions in 2019, the state will provide considerable leeway to families regarding the COVID-19 vaccinations. Can you speak to this?
Well, first of all, although the president has talked about mandating vaccines for COVID for school children and staff, they would not be required, and there's no intention that I've heard about or read about that they would be required before those vaccines receive full FDA approval, not just emergency use authorization, But when the experts and scientists have felt that, boy, enough has been known about this to say it's safe and it's very effective, at that point, they would they're considering, and the president has announced that they would make it a requirement for entry into schools. And yeah, I'm sure that there will be some exemptions for medical reasons, and there may be other reasons for exemption as well. Does that answer the question?
It does, thank you.
Okay. The other thing I might say is that the way they're looking at it now, according to the California Department of Public Health, what I've heard is they would make those mandates on a sort of a school grade-based level. So since the 12 to 15-year-old vaccines came in first, and along with the 16 and 17-year-olds, they would do that group first. And the earliest I've heard that they would probably put that into force is probably in July of 2022. And then they would be waiting some time before they did the mandate for children that were 5 to 11 years old.
Thank you, Dr. Coren. And let's move on to Mendocino. Oh, wait, we skipped one. So let's do Independent Coast Observer. Susan, do you have any more questions?
Yes. So in that case, Dr. Coren, the COVID vaccine would be just like all the other vaccines children are required to get to go to school now.
Correct. It would be a requirement to enter school.
Okay. And one other question, have you gotten a lot of pushback from teachers that don't want to get vaccinated and school staff?
No, actually, in our county, teachers were very quick to take up the vaccines, and they've been blessed with a lot less illness as a result of that. Same thing with staff. We had, as you remember, we passed a order probably a couple of months ago for fire, EMT, and law to get vaccinated, or if they were not vaccinated, to be tested on a regular basis. And that has gone well also. The group that is a little further behind are those in law enforcement, and that is a scenario that's playing out as true throughout the rest of California and the rest of the country.
Thank you.
All right, let's move on to Mendocino Voice.
No further questions.
Okay, thank you. And how about Mendocino Action News?
You might have already went over this a little bit, Dr. Coren, but if you can reiterate the booster or third dose. I know it's kind of changed a little bit about allowing people to have the booster. What are the requirements again?
For the booster?
Correct.
So for the Johnson & Johnson booster, you need to be 2 months past your dose, your initial dose. For the Moderna or the Pfizer boosters, you need to be 6 months past your last dose. It is at those times that we think that the efficacy of the vaccine may be waning. And so who needs a booster and should receive a booster? We're recommending for those people who are 65 years old and older, people who live in long-term care, that would be nursing homes, but also there are long-term care facilities and assisted living. Those people who are between 50 and 60, or from 50 through 64-year-olds who have underlying medical conditions or an increased risk of social inequity, or those people who, for example, might be disabled, people from minority groups who do have traditional social inequities that might leave them to get to be more at risk. And those that's recommended to consider these boosters are people 18 through 49 years old with underlying medical conditions, and 18 through 64-year-olds who are at increased risk of exposure due to their occupation or institutional setting. And I'll run through that list if you'd like. One is first responders, and that's healthcare workers, firefighters, police, and also congregate care staff, education staff, and that includes daycare workers, support staff, teachers, food and agricultural workers, manufacturing workers, corrections workers, U.S. Postal Service, public transit workers, and grocery store workers. So those are people who are felt to be at increased occupational risk. We are not screening people for those risks. We ask people to look at these recommendations and self-attest, and then and then we can give them their vaccine and record what the reason was, so that we can record that for our CARES reporting system.
And to share just a personal note, when I went down to Safeway to get my booster, there was just a simple checkbox and a little signature. So you check the box that you felt applied to you, and then signed it and gave it back for your self-attestment.
Thank you both. I appreciate that.
Thank you. And this is great because there was a question on Facebook wondering who are the boosters for? So it looks like we've answered that one.
Good.
So another Facebook question is wondering what kind of side effects are kids getting from COVID vaccines?
Well, the usual vaccine side effects that we all get, but they get a little bit less. So things like the site of the injection, they get some pain initially. They can get some redness and mild swelling. They may get headaches, muscle aches and pains. They may get low-grade fever for a day or two. Some will have some stomach upset. Those are the main side effects that they have been getting. For the 5 to 11-year-olds that have been vaccinated, more serious side effects have really not been seen. As you know, in the older teenage boys, they had a concern about myocarditis and pericarditis, which is an inflammation around the heart. Now, that is an illness or a condition that happens with many, many other viruses and many other conditions that people can have. When they reviewed this for the new authorization for the 5 to 11-year-olds, they did produce a graph. I didn't put it up today, but the severity of the myocarditis for the COVID vaccines is significantly less, and required, I think, only 1 or 2 hospitalizations, no deaths, and they're usually treated with rest and some Tylenol or an anti-inflammatory, and they resolve nearly all of them within about a month. But it has been a concern, and they looked for that in the younger age groups, and just they haven't found it in the 12 to 15-year-olds. And of course, we haven't seen enough in the 5 to 11-year-olds to know if that's the case, but it's not felt to be likely to be more a significant problem. The older age kids also in their teen years have a little bit more incidence of fainting right after they get a shot, and they come right out of it. It's not a significant or life-threatening thing. It's just one of those reactions that some people will get after an injection.
Great, thank you, Dr. Coren. One more question from Facebook, and they're wondering about the county following up with people with a positive PCR test for COVID versus a rapid home test, and kind of the difference between those tests and who we follow up with.
Well, that's very good, because it's changing now. It's rapidly changing. We're getting a lot more confidence in the quality of the results we're getting from the rapid tests. So we used to do a lot more confirmatory testing than is being recommended now. The other thing is the county can see the results. We get reported back the results of PCR tests. And so we follow that up a little bit more closely because it comes out on our reports. Whereas the rapid tests are not necessarily reported through CARES, and they don't come up in quite the same way. But I think that's changing now, and fairly soon I think we'll see a lot more antigen tests being done and accepted on their face value, and very few will require confirmatory PCR tests. But I'm not going to go through the charts and recommendations according to the flow charts detail by detail right now.
Okay, great, thank you. And let's see, it's about 5 minutes to 3. So I don't think we have enough time to go through every news media outlet round. So I think at this point, the best thing to do is give Dr. Coren a chance to give some closing comments, and then we'll end it.
Well, I want people to understand, that we came off of the summer-fall surge, which for Mendocino County was much worse than the surge was in the winter, which was bad enough. But we didn't go back down to the normal low levels of COVID incidence in our county. And we started showing an increase slowly several weeks ago. And now we're seeing throughout the rest of the Northern California and California as a whole that the numbers are going up. I can't yet predict whether this is going to be a very severe surge in and of itself. It is predominantly those people who are unvaccinated, who are very sick and require going into the hospitals. And so that's one of the concerns that we have, is the burden on the healthcare system. And it's a little bit too early to see whether that portion of the population will account for enough to burden our hospitals and our healthcare system. But if you add that to the flu season, it could really tip us over into a very bad place. So as I said, we had only one ICU bed today, and that would be very bad, not only for people who have COVID, but for the rest of the population if people have a heart attack or something like that. So going into the season, we're not going in on a strong footing, and things seem to be getting worse. And I want to really encourage people to get vaccinated. They're very effective, very safe, very accessible vaccines to get if you haven't gotten your first dose. If you are due for a third shot due to immune compromise or age, or a booster shot for various reasons we went over, please get those now before it's regretted in another month or two if you catch it. That's the best way to prevent a surge for our community. And to remember that the non-pharmacologic behavioral recommendations that we make are still very effective, and people should continue to do it even though they're a pain in the neck, they're uncomfortable, but they're much less painful, much less uncomfortable than you or a loved one winding up in the hospital. And so I would just summarize and say, let's get vaccinated and let's keep ourselves safe, and hope for a much nicer holiday season than we had last winter and over the summer.
Thank you, Dr. Coren. And thanks to everyone that listened and asked questions today. We're going to be taking a break in the next 2 weeks for Media Day. So the next one won't be until December. That'll be Friday, December 3rd at 2 p.m. So we look forward to seeing you then. And you can always get updates on mendocinocounty.org/COVID-19, or check our Facebook page as well. So thank you and have a great weekend.